Welcome to The Explainer. Today, we're going to talk about something that can start off looking like a regular old bug, but turns into something way, way more serious. We're talking about a lung abscess. So, let's get right into it. So, really, think about this for a second. What happens when an infection in your lungs decides it's not just going to spread, it's going to build a fortress, a walled-off, destructive cavity deep inside your lung tissue? Yeah, that's pretty much exactly what a lung abscess is.
The crazy thing is, it often starts off looking so normal. You get a fever, chills, a really nasty cough, some chest pain. Doesn't that sound just like a classic case of pneumonia? That's why it's so tricky to catch early on. But there's one clue, one symptom that totally changes the game.
And this is it. This is the big one. Sure, lots of infections make you cough up stuff, but a lung abscess can produce foul-smelling sputum. That really specific, really unpleasant sign, it's basically a direct message from the culprits. We're talking about anaerobic bacteria. These are the kinds of germs that live without oxygen, and they are literally just dissolving your lung tissue.
Okay, so let's dig into what really makes an abscess different from your run-of-the-mill infection, because it's a whole lot more than just a bad case of pneumonia.
All right, so let's translate this medical speak, right? Localized collection of pus just means the infection has been walled off, contained. And necrotic debris, well, that's just a fancy way of saying dead lung tissue. So what's happening is the bacteria carve out a cavity, they fill it up with pus and dead tissue, and boom, you've got that fortress we were talking about right inside the lung.
Now, these abscesses pretty much come in two main types. First, you've got the primary abscess. This is actually the most common one, and it happens when a person who's otherwise healthy just breathes in some bacteria, usually from their own mouth. Then there's the secondary abscess. This one's different. It pops up in someone who already has a lung issue, maybe a tumor that's blocking an airway or something like that. And this difference is super important because, as we're about to see, it completely changes a person's chances of recovery.
So how in the world do doctors actually find this hidden fortress? How do they look inside someone's chest and say, yep, there it is, a cavity? Well, the hunt usually begins with a tool that's been around for over a century, but it's still incredibly powerful: the chest X-ray. But they're not just looking for any old spot or shadow, they're searching for a very, very specific sign. And there it is, the smoking gun. On an X-ray, a lung abscess often shows up with something called an air fluid level. The best way to picture it is like a bottle of water turned on its side. All the gunk, the pus, and the liquid debris, it all settles at the bottom, right? Gravity. But the gases produced by the bacteria, they float up to the top. And that creates this perfectly straight, horizontal line. That right there, that's the classic signature of a lung abscess.
Okay, so we know what it is, we know how to spot it, but how does this even happen? What's the root cause?
Well, take a look at this chart, because the answer is pretty undeniable. A whopping 70% of primary lung abscesses are caused by aspiration. And all that means is that stuff from your mouth or throat, which is, full of bacteria, accidentally goes down the wrong pipe, into your lungs, instead of into your stomach. And this is how that one little event spirals into a full-blown abscess. It's a really destructive chain reaction. So first you have the aspiration event. That immediately kicks off a bunch of inflammation in the lung, which we call pneumonitis. Now, if that's not stopped in just a week or two, the infection gets so bad that the lung tissue actually starts to die. And then finally, the body goes into defense mode. It tries to wall off the damage, and that's what creates the abscess cavity itself.
So the obvious question is, who's at risk for this? Well, basically, it's anyone whose normal protective reflexes, like the gag reflex, aren't working right. Think about people with altered consciousness from heavy drinking or seizures, or someone who has trouble swallowing. And here it is, the link we've been hinting at: poor dental hygiene. It's simple, really. The more bacteria you have in your mouth, the more dangerous stuff there is to accidentally breathe into your lungs.
All right, an infection has built its fortress. So how do we fight back? How do we tear down those walls? Let's get into the treatment. Right off the bat, you need to know this isn't a quick fix. Not at all. Treating a lung abscess is a marathon, not a sprint. We're talking about a long, aggressive course of antibiotics, usually for 3 to 6 weeks. That's how long it takes to really get inside that fortress and wipe out the infection for good. Now, for most people, thankfully, those long-term antibiotics are all it takes. They do the job. But there are exceptions. If the abscess is huge, say bigger than 6 centimeters, or if it's just stubbornly refusing to shrink with antibiotics, then doctors have to get more hands-on. That might mean draining the pus out with a needle, or in really rare situations, even surgically removing that whole damaged part of the lung.
Okay, let's wrap this up by talking about the prognosis. What are the outcomes here? And maybe most importantly of all, how do we stop this from ever happening in the first place?
This chart really tells a tale of two completely different outcomes. It's dramatic. If you're a healthy person and you get a primary abscess, the odds are fantastic. We're talking a cure rate of around 90%. But if it's a secondary abscess, one that's caused by a serious underlying issue like cancer, the story flips completely. The outlook can be really, really grim, with mortality rates as high as 75%. It's a huge difference.
And that brings us right back to what is probably the most crucial part of this whole discussion, prevention. It really all boils down to managing those risk factors we talked about. And look, it's not rocket science. We're talking about practicing good dental hygiene to keep the bacteria in your mouth in check, being smart about alcohol, and managing things like acid reflux that can make you more likely to aspirate.
So who knew, right? Who knew that one of the biggest secrets to protecting your lungs could be sitting right there in your dentist's chair? It's kind of a wild connection when you think about it. It just goes to show you that sometimes the best defense against a really serious internal infection, well, it starts with something as simple as a toothbrush.